Hi, my name is Komal Farooq and I'm a chartered physiotherapist. I had an incident where a lady, she had a history of fall, but she ignored her symptoms and she continued to work. And after a few days, her leg was like this. And it happened because there was micro fracture inside her knee joint, and that was bleeding, but it wasn't a massive bleeding, but it was bleeding very slightly. And after, as she continued to work, and it was prolonged standing, and that due to the gravity, the blood start coming down towards her legs, and that caused her hematoma formation in her leg. And when she came, and then when I realized, and she said, no, it's not painful, but it just feels the bruises around her leg. And then I explained her in detail that it happened because you had the microfracture, and then that is causing you the bleeding. And I recommended her to just seek urgent medical attention, as she said that it's fine, she's not feeling any pain, so she haven't been to the doctor before, but she was ignoring her symptoms. And then I said, no, you need to go to the urgent medical care, and then they should do the x-rays, and then they see maybe there is a microfracture or something that is causing you that hematoma formation. So luckily she went to A&E, and then they found out that there was a microfracture in her knee that was causing her this type of bleeding. So if in any case, if any one of you who is going through any kind of the bruises or something, don't take it lightly. Please assess yourself. If you feel like it is getting worse, or it's getting more and more bluish or bruises, and then you have to seek urgent medical attention. And maybe there is something like a microfracture, a micro tear in your muscle that is causing you this hematoma formation. And what you have to do in case if you have this type of problem, for in case if you have in your legs, mainly it happens in your legs because our knee is more prone to the microfractures, and it can cause you the micro bleeding inside, and it can lead to the hematoma formation. So what you have to do in case if you have this type of problem, first thing you have to do is to do the leg elevation as much as you can, so that the blood flows back towards the system. So that's the first thing you have to do. And the other thing which I recommend is the application of ice. That's very important because this ice application, it will constrict the blood vessels, and it will prevent the bleeding, and then slowly start getting better. But it's also important to seek the medical attention as well, so that they can assess you and they can do the x-rays, MRI scan to see what's happening inside the joint. Thank you so much for watching.